Good afternoon. Today we have Dr. Seraphine Kaminsa with us. She is the Senior TV Technical Advisor at Save the Children. Seraphine, could you please explain to Qure colleagues your life as a doctor and also what made you to switch to TV and HIV?
Thank you, Dr. Shibu, and thank you so much for inviting me to this opportunity. Well, my interest in tuberculosis started when I was in medical school. Actually, for my sixth year community medicine, I really got attracted to one of the programs that was at our medical school called Zambia, which has done a lot of studies. And they had their office in our medical school. I would go and peep and see what they were doing, and I got to know the people there. And over the years, I've remained close to them. And following my ending of my medical school, I had opportunities to work with the government and actually support a program with Zambia. And with my opportunity to do a Master's of Public Health, which I did at the University of Alabama in the US around 2003. Again, I met with a very well-renowned medical doctor, Dr. Michael Kimmerling. He was one of my mentors, and it just flowed into TB again, and more interest, lots of opportunity. I came back to Zambia and joined CIDES, the Center for Infectious Diseases Research in Zambia, around 2005. And my focus then continued to be mainly HIV care and treatment. As you know, PEPFAR provided antiretroviral treatment around that time. And then I also supported a lot of the development of the TB protocols and the reporting and recording tools, the algorithms, which are now standardized in the smart tools that we have in the country. Then I continued on to lead 2 projects under Family Health International, which were global projects with USAID funding, called the TB Cap and TB Care 1. And I moved to Malawi, continued on with the Challenge TB and the KNCV, which is a solely TB based organization. So working with KNCV in a country that has done so much of best practices in TB was such an amazing experience. And I looked forward to work in Malawi. Then I moved on to PATH and met you, Dr. Shibu, there, and moved on to Save the Children, where I'm now the Senior TB Technical Advisor, solely focused currently on Global Fund grants in Asia, in the Pacific region, and we have some other HIV, malaria, COVID grants in Africa.
Wonderful journey, because I was thrilled to hear that you have a Malawi experience. Every TB barrier would want to have something to be done in Malawi, because Malawi taught the world. Because I still remember that Carol Stibulo's experience in Malawi, going to household and then kind of like coming up with the Stibulo modeling. So I know that when you're in PATH, you also leverage technology for case finding. And you leverage X-rays in mobile vans, and then you leverage that for case finding, active case finding among communities and also in facilities. Could you please elaborate on your experience with technology and especially digital technology and AI and how it benefited the Zambian TB control program and also your project?
So over time, I've seen how beneficial AI has been with the rapid screening of individuals. For example, in a prison setting, we're able to do mass screening, biannual mass screening, and we really targeted the prisons with a large population, settling to work for about 3 weeks to 4 weeks, a lot of intense collaboration, and with not just the Ministry of Health, the Ministry of Home Affairs. And it really brings up an opportunity to use new technology and have a multi-sectoral approach. And when we came to Zambia, we were actually able to use the digital X-ray with AI in a health facility setting as well. Quite interesting, because we used it in people living with HIV, and we saw a large uptake, and we saw a large positivity of individuals that had TB in tertiary level facilities. And then we also used it in the community setting. So it's very interesting that it's quite versatile.
Correct.
Yes, to use the...
So it's interesting to summarize that you have
Yes.
you have technology acquaintance in multiple settings
Yes.
and multiple use cases in the
Yes.
community settings, in hard to reach areas,
Yes.
And also in facility settings.
Yes.
And you see value in actually case finding, even in HIV special population. Also, you are seeing that this
Yes.
technology is working well.
Yes.
So switching to your current role as Save the Children from a global perspective, you are actually managing multiple grants in multiple countries. Where do you see how this kind of technologies, now this being WHO approved and endorsed,
Yes.
and part of the global
I'm so happy about that.
global guidance, and probably your early evidence also might have contributed to WHO to take that call to scale it up. So how do you see that in your current scheme of things, like this technology is actually reshaping the case finding?
Yes, it is. And because I'm supporting countries that some have already started using the technology and others are still introducing it, you do see the variance in the uptake. And the opportunity to use it with the new recommendations from WHO really gives the green light for countries. And I feel that has really brought the opportunity to expand use of AI and use of digital technologies. And I'm really hoping that on the market, there will also be an opportunity for countries to see the different vendors and what are the benefits of a particular tool. Because with the history of having experience with the tools that we used, we had to wait on the manufacturers' teams to come in country, provide the TA, because some of the equipment was complex and required a lot of user maintenance. So now I feel with the newer, more portable versions, countries can move quickly, adapt. They're less costly than the previous, vehicle. Almost $500,000. This is about $70, $80, etc. So it's much easier to utilize. And the Global Fund has also provided opportunity in their guidance, in the new guidelines, as well as in what we're calling the program essentials, where they really want to see active systematic screening and use of AI as well, and use of modern digital technology. So even in my work, I'm encouraging my counterparts to include in their national strategic plans, in their planning with the grant making programs. Even as we have been doing the funding requests, it has been an opportunity that has been included and in the countries I support.
Perfect. I think you raised a critical point that
Yes.
the complexity of the hardware and also the ease of doing technology in the field, because we're positioning this as a solution to fill the gap of the skill set available.
Yes.
But still there are complexities, attached to the functioning of the hardware. But also you're saying that now we are seeing promising advancement in that, making it much more less complex and
Yes.
much more compatible.
Yes.
Which is a fair point to actually consider when we are scaling up such technology.
Yes.
Switching to your current role, again, Save the Children, focus on Save the Children, right?
Yes.
And pediatric TB has been a challenge for many years.
Yes.
And I don't think that we have a straightforward tool to diagnose Save the Children with confidence, right? And I would like to understand what kind of approaches from the Save the Children side has been kind of thought about and deployed in the field for pediatric TB diagnosis. And also the second part of it, like how do you see that X-ray being positioned as an augmented tool to help the decision making for pediatric TB diagnosis?
Thank you so much for that question. I'll give one or two examples. We have children, most of them seen at tertiary level hospitals, traditionally, because that's where we would find the pediatricians, etc. But we went ahead to do some assessments, and I'll give an example from my previous work and my current work. So in my current support, one of the countries has identified malnourished children based in hospital settings or other health facilities, and actively screen them for tuberculosis.
Okay.
In addition to the children that will be walking in and with their parents, etc., for other disease presentations. Then they've also recently partnered with another department for maternal and child health to actively screen children who are coming to under 5 clinics, and mothers, pregnant women, etc. Just have that holistic approach for maternal and child health. So for us, that is a plus, because now we're able to go beyond the cascade of care or the patient pathway from the community level, but we target also the tertiary level. And with that, the children have access to immediate care. Once they're screened, they don't need a referral system. They can be identified and managed in the same facility. If it is complicated, they will be referred to the next tertiary level. And the skilled clinicians don't necessarily have to be a doctor to screen the children. Other healthcare providers are able to screen the children. So that allows for children to be screened quickly. In the setting with PATH, we actually did have a weekly screening of children with the mobile van, which was able to be used at another children's hospital without the card for TB. As you know, it's not yet recommended for children. Yes, but we had the digital component of the X-ray available to screen the children, and that also gives early access to a rapid screening process and a sensitive tool. So those are some of the examples. And in Save the Children, because we have other departments that we are collaborating with, other units, we are also trying to engage the sexual rights and the sexual health and rights team that's working with the adolescents. So we need to identify how do we start approaching adolescents in their own environments to screen them for TB. We are looking for opportunities with the nutrition group, because Save the Children is very strong with nutrition care, as you might be aware, for children. And we feel that's also an entry point where we can consider TB screening. And our team has been brainstorming. We have a capacity statement. We have our own HIV-TB strategy. And through that, we are trying to also share in some of the best practice sharing platforms that we have created for our team with our other team members, to really bring out a consciousness on having TB on the agenda for child health in a non-health organization that really looks at more of child rights, safety, and other areas of education, etc. But health is also an important element in Save the Children.
Yeah, so if we would want to summarize that, you said within the pediatric domain, you're doing a multi-pronged approach for prevention. You're also looking at vulnerable child to that screen. And then top up with nutrition. So it's a comprehensive strategy. You also mentioned about the use of digital X-rays, but you rightly said that less than 15 years is not recommended by WHO. But again, I just want to share the experience of our partners who have been using our algorithm. They're also finding promising use case in the pediatric population. If they ran the same algorithm. And also I just want to mention that in the current World TB report, it's been mentioned that there's a need for less than 15 years AA algorithm for enabling pediatric TB detection. And incidentally, I just want to mention this also. We are enriching our algorithm to make it much more pediatric specific, and also have segmented, also call out severe and non-severe disease, which is good. It's a good fit for the newer regimen. Yes,
definitely. And as you are rightly saying, we definitely need to have a quick movement on children. I think children are always left a bit behind, and then somebody remembers, oh, we have the children. So it's so exciting with what Qure is really looking into, and trying to find a way to include the children in the screening with modern digital platforms. And I do hope Save the Children can have some voice in that. We definitely look forward to partner with you on more opportunities.
Absolutely. It's a pleasure to have Seraphine here as a colleague, and also a passionate doctor and working with pediatric population. I mean, you're there for a good cause. So I need to appreciate you.
Thank you so much.
We look forward to collaborating with you in future as well. So thank you so much for talking.
Thank you. And I'm very happy to be here. Thank you so much.